Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for May 19th, 2020. Just wanted to let you know that this evening our second round of regional health town halls will take place. Tonight it will be with on Vancouver Island. Liberal health critic Norm Letnick will be there, along with Ronna Ray Leonard, the MLA for the Comox Valley, Kathy McNeil, the President and CEO of Island Health, and Dr. Richard Stanwyck, the Chief Medical Health Officer. On Friday, May 22nd, there will be a town hall, virtual town hall in Fraser Health, Bob Deeth, MLA, Joan Isaacs, MLA, Dr. Victoria Lee, the President and CEO, and Martin Lavoie, the Chief Medical Health Officer, Dr. Martin Lavoie. Also, tomorrow, the Minister of Education, Rob Fleming, will be joined by BC School Trustees Association President Stephanie Higginson to have a town hall. All of those town halls are at 7:15. Tomorrow, there won't be any briefing in person tomorrow. There'll be a written briefing tomorrow at 3 o'clock with tomorrow's case numbers, and Dr. Henry and I will be returning here on Thursday at 3 o'clock. And with that, I'm happy to introduce Dr. Bonnie Henry. But before I do that, I just want to note that we're here on the traditional territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Dr. Henry.
Thank you and good afternoon. I'm happy to report today that we have 2 new cases of COVID-19 who have tested positive here in the province in the last day, bringing our total to 2,446 people in British Columbia who have tested positive. That includes 883 people in the Vancouver Coastal Health Region, 1,196 people who reside in the Fraser Health Region, 126 people in the Vancouver Island Health Region, 181 in the Interior Health Region, and 60 people in the Northern Health Region. We continue, as people are aware, to have active outbreaks in our healthcare system, including 14 in long-term care or assisted living and 5 that are ongoing in our acute care system. There are no new outbreaks, and we have only 1 additional case in those outbreaks, bringing our total to 326 residents who have been affected and 203 staff. As well, we have no new community outbreaks to report, and the ones that we have been following continue. We have right now 325 active cases around the province, and of those 45 people are hospitalized, including 12 who are in critical care or ICU. On a sad note, we have 3 additional people who have died from COVID-19 in the past day, bringing our total number of people who have died to 146. So that includes 1 in Vancouver Coastal Health and 2 people in Fraser Health, all of whom were people in our long-term care system. And our condolences go to their families and to their loved ones and to their care providers. We now have 1,975 people who are fully recovered from COVID-19. As people in BC are no doubt aware, today is an important milestone for our province. Today is the first day that many businesses can begin to reopen. For employees, customers, and business owners, I want to reassure you that we would not be easing these restrictions if we did not feel we could do so safely. And we have been talking about that for some time, how important it is that we continue to monitor people who are showing symptoms across the province, the outbreaks that we are continuing to manage. And we will be and will continue to do this in public health. Protecting everybody in British Columbia is and will remain our number 1 priority. But we can do this, and we will do it slowly and thoughtfully together. We can flatten our curve and safely reopen our province. But we must take it slowly. Just like the BC Restart Plan that we talked about a little over a week and a half ago, being thoughtful and cautious is how we need to proceed in the coming weeks. The approach will give you, your employees, your customers, and all of us the confidence that we need that we're doing all we can to keep people safe. I also remind businesses that they need to follow the guidelines provided by WorkSafe BC in concert with public health, and that we need to have a COVID-19 safety plan in place. And this is a way of us all being explicit about the things, the measures that we are doing to protect our businesses, our employees, and our customers. As we know, the WorkSafe BC and the public health guidance is now available for many different sectors, and the work is ongoing, and more will be available in the coming days. We're working on that now. A lot of consideration has gone into this, and the guidance really balances the need to be practical and sensible and safe by allowing businesses as well to adapt the guidance to their own situation and their own employees, their own facilities. I encourage you all to do the same, to assess the risks, to determine if you can safely reopen your business, and take the time that you need to do that. Put the precautions in place and be safe. You can, of course, talk with your local public health, in particular the environmental health officers who are very good at this. This is the work that they do to support you in this, and to talk to WorkSafe BC. And then your first call is WorkSafe BC 1-888-621-7233, and there is a hotline there where you can get information to help you interpret your specific needs for your business. As well, if you are a regulated health professional, your regulatory college has guidelines for you that you can use to safely expand the activities and the services that you're providing in the community. So staying vigilant is even more important as we ease these restrictions and we start to interact again, both in our social interactions, but also in business. Every day, all of us must pause and think about how we're going to keep ourselves, our families, and our communities safe. Our individual circumstances are unique, but the actions we can take to protect each other and ourselves are the same. And that is the same things that we have been talking about for many months. Ensuring that we keep a safe physical distance, cleaning our hands regularly, covering our coughs and sneezes, making sure we don't touch our face. And incredibly importantly is staying home if we're feeling ill at all. Staying away from others is incredibly important. Simple things can make a big difference, but we need to go slowly. Keep those few faces and big spaces top of mind. Be aware of your location, the duration of time that you're going to be there, and who you're going to be with, and who is at home that you need to make sure that you're protecting. Wash your hands regularly. I have no doubt that we will get through this by working together and working out the kinks over the coming weeks, and by continuing what we have been doing all along, which is being kind and being calm and being safe.
Thank you very much, Dr. Henry, and I wanted to join you and the Premier and everyone in BC in passing on our condolences to the 3 people who have passed away in the last 24 hours from COVID-19 in BC, 2 living in the Fraser Health Authority and 1 in the Vancouver Coastal Health Authority. We know what a difficult time this is. That makes, of course, 146 people who've passed away from COVID-19 since the beginning of this pandemic, and it's obviously for all of us a very sad day every day when people pass away from COVID-19. So we want to express both our recognition of the sorrow of caregivers and of families and of friends, and also our recognition of the significance of the lives led and how much those people will be missed. As Dr. Henry has said, there are 2 new cases today, which is obviously in and of itself positive news. When you're testing and you're looking for cases and you only find 2, that's a very positive indication. That said, we still have 45 people in acute care and 12 in critical care. That's 21 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 2 in Northern Health, and 20 in Vancouver Coastal Health. I note that we continue to see people returning and using emergency rooms, not to the extent they were prior to March the 9th, in that period, but still significantly. Again, yesterday, just under 4,975 people visited emergency rooms. One of the issues for people in visiting hospitals, of course, one of the reasons why that number dropped, even though we continued to provide healthcare services to under 3,000 at one point in April, was to a degree fear in a sense that people shouldn't go to the emergency room when they needed to go. And we have been, I think, pretty consistent in trying to ensure that that happens. And that's, of course, often a concern in the healthcare system for people with disabilities. We have, as everyone knows, a policy that strongly restricts visitation in both hospitals and long-term care to what are defined as essential visits. And that provides, and from the beginning we provided hospital care teams direction on what type of visit is essential, including for patients nearing end of life, or visits to provide specific types of care for patients with unique needs. Policy is based on advice from the provincial health officer and her team to prevent the deadly spread of COVID-19 in BC hospitals based on the experience, evidence, and data she has had and everyone in the healthcare system has had in addressing pandemics in the past, or many in the BC health system have had. We are making a small revision to that policy today, a significant one, to make sure healthcare providers have clear guidance about the considerations they need to make when deciding whether a visit is essential. For example, they need to consider the importance of assistance for persons with disabilities who have special needs, such as feeding, mobility, communicating, or need assistance in decision-making. Those changes will be posted today, and they're significant changes for people. They came at the request and the concern of people in the disability community so that they would have the confidence to visit hospitals, and they're also, I think, will be helpful with our staff in making those important decisions around essential visits. And I just wanted to read the three specific considerations here that essential visits include assistance by designated representatives for people with disabilities, including provision of emotional support, visits for supported decision-making, and communications assistance for persons with hearing, visual, speech, cognitive, intellectual, or memory impairments. Those will be posted today, and I want to thank everybody, including people in the broader disability community, who provided us support and advice in making those additions, that new guidance to the essential visits policy. On Tuesday, we provided an update on the PPE that we've received over the past week. To recap, cumulatively, in past weeks, I've announced that the following PPE has arrived in BC since the beginning of April. Approximately 4 million N95 respirators. 63,000 of those are from the federal government's bulk procurement. 3.5 million surgical masks, that's 146,000 from the federal government's bulk procurement. Over 1 million pieces of eye protection. 212,000 of these are face shields from the federal government's bulk procurement. Approximately 11 million pairs of gloves. 440,000 of these are from the federal government's bulk procurement, and close to 1 million gowns. Today I can tell you that since last Tuesday, we've received 14,730 N95 respirators, 786,155 surgical masks, 15 million pairs of gloves, 265,000 pieces of eye protection, and 320,000 more gowns. As always, any product that we've received that isn't from a trusted, reliable vendor will be subject to assessment and testing before it gets into the health system. This also includes masks and respirators received from the federal government, as well as donations. Just wanted to update you. As you know, yesterday we resumed non-urgent scheduled surgeries in addition to the urgent and emergency surgeries that continued under our initial response to COVID-19. We announced this policy on May the 7th and have worked over the past week with patients, calling them to see if they're comfortable coming in for their surgeries, as well as to book non-urgent scheduled surgeries. All health authorities have now started non-urgent cases, all 6, including the Provincial Health Services Authority and the 5 other health authorities. They're performing them currently as of May 19th at 49 sites. 16 sites in IHA, 11 in Fraser Health, 2 in Vancouver Coastal Health, 8 in Vancouver Island Health, 9 in the Northern Health Authority, and 3 in the Provincial Health Services Authority. We will be reporting on estimated numbers of non-urgent surgeries to be completed this week in the coming days. along with the calls that have been made and urgent and emergency surgeries completed in the past week. We know that it takes time to schedule patients, complete any preoperative testing, and even be reassessed by physicians. We also know that our hospitals have made changes to their staffing and in some cases physical spaces to respond to COVID. And of course, many sites are still responding to COVID with patients in their hospitals. That's why it'll take approximately a month to get back up to a near normal pre-COVID level of operating for scheduled surgeries. I wanted to thank everyone involved in this extraordinary process, extraordinary at both ends, extraordinary that during COVID-19 so many surgeries, urgent surgeries and emergency surgeries were done by nurses and doctors with the support of healthcare workers and health sciences professionals across BC, and extraordinary that we have managed to get the system back up and running for scheduled surgeries in the last little while. On January 21st, Dr. Henry and I issued our first statement on COVID-19. That's 17 weeks that have passed since then. 17 weeks. Weeks that saw COVID-19 arrive in BC, weeks that saw us launch our BC pandemic response, and weeks that changed everything in how we live our lives. And along the way, the people of BC stayed apart and worked together, and we bent our curve. Everyone in BC, all of you, made a difference. Starting today, much more is possible in social, surgical, and economic renewal than was the case just yesterday. Some businesses and services will open right away, others in a few days or weeks. Some of us will safely expand our contacts with businesses, services, and friends and family right away. Some of us will do so when we feel it's time, the right time for us, the safe time for us, given our unique circumstances. Phase 2 is here, and with it, the freedom to participate in renewal. Our individual comfort zones will dictate when we take advantage of the opportunities Phase 2 offers. And when we find our comfort zone with these enhanced contacts, when we have the confidence that they are right for us, then we safely participate in Phase 2. The one thing that hasn't changed, and this won't change for months, is our need to keep using the skills that Dr. Henry and medical health officers from across BC have taught us to stop the spread and to stay safe. These are the skills we must continue to use in the days and the weeks and the months to come. Today marks a key transition in our BC pandemic. No matter when and how we choose to participate in Phase 2, staying 100% all in the effort to stop the spread and keep us safe is essential to our continuing BC COVID-19 effort. Aujourd'hui, nous annonçons 2 nouveaux cas pour un total de 2446 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19, dont un dans le région de santé de Vancouver Coastal et 2 dans le région de santé de Fraser, pour un total de 146 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé de la Colombie-Britannique compte toujours des patients atteints de COVID-19. 883 se trouvent à Vancouver Coastal, 1196 à Fraser, 126 sur l'île de Vancouver, 181 dans l'intérieur et 60 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 45 personnes sont actuellement hospitalisées, dont 12 en soins intensifs. Thank you very much. Merci beaucoup. Happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question. I would also ask that you please unmute your phone. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good afternoon. Got a note from someone up in the Cranbrook area who's been doing an inventory of visitors from Alberta who says there's an awful lot of people coming into southeastern BC. He pointed out that Manitoba for a while now has been stopping people at the border and saying you have to self-isolate if you're coming in from Ontario. Saskatchewan has discussed it, and I believe Yukon is doing it. Have you thought of more screening at the borders for people coming in from other provinces, or are you content with the way it's going now?
Yeah, so we've had those discussions both nationally and certainly within British Columbia, and it really is not practical for us to have those types of restrictions in our borders in Canada. Manitoba and the amount of travel that they have may be quite different. Certainly, Saskatchewan is not doing that right now. They do have some controls in place where they have a large outbreak now in the north. And it just goes to show us how challenging it is to manage this virus. And we really have to be prepared for it to arrive anywhere, whether we have these restrictions in place or not. And we have a lot of people who may have Alberta license plates, but they may actually be BC residents. And we know that there are a lot of people who work back and forth across the border. And as a matter of fact, in much of southern British Columbia, the closest health care that people get is actually in Alberta. We are very much integrated with our respective provinces and how we have many different industries, trade, medical supplies, people, families that are across the borders. So no, I don't feel it's practical. We don't feel it's practical to have restrictions on our borders. We are leaving it up to people's good behavior, and for the most part that has worked. And we can't assume just because we see an Alberta license plate that somebody is a visitor. It could be somebody who works here and who lives in Alberta, or vice versa. So I think we need to continue doing what we're doing. The same messages are going to people in Alberta. And I will say the one exception is that we know that there have been a number of quite high-profile outbreaks in particularly in some of the industrial camps in north of Fort McMurray. And those people we are following up on, and we are asking them to, requiring them to self-isolate when they come home to BC, because we know there's ongoing transmission in those settings. So with that exception, I think we have been working very hard with our counterparts in Alberta to make sure that we inform each other when there are outbreaks in our communities, so that we can do that contact tracing and providing the important advice to people who are contacts of cases across the borders.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Health Minister Dix. I'm hoping to ask you now just about the rollout of the industries, including places like hair salons, which wondering what kind of challenges you're encountering trying to set new regulations for places like hair salons, which were not regulated before the pandemic, and how can the public trust proper safety precautions are being taken apart from a notice going up in a window?
Yeah, so this is not regulation. What we are doing is providing updated health and safety guidance that businesses must follow. And that's why we are requiring, and there's an order in place that requires businesses, all businesses, to post their plans publicly. And that's where the accountability is. It's the accountability to the public, to be able to see what people are doing, to your employees, that they know the measures that you're taking, and the guidance that we have put out specific to the different sectors is available on the WorkSafe BC website as well. So you know what the guidance says. We know what type of measures need to be in place, and the accountability is with the public posting. So it's not a regulation, but there will be an inspection process based on priorities. So we're looking at some of the higher risk areas that we know of, like some of the processing plants, the meat processing plants, fruit and vegetables, places like that. As well, if the public has concerns about how people are implementing their COVID-19 safety plans, if they can talk to their local public health EHOs, who can do inspections on a complaints basis. There's also, if you're an employee and has concerns, then you should talk to WorkSafe BC, because WorkSafe BC has inspectors who are able to follow up on those as well. So that's the how we're rolling it out here. The accountability is to all of us to understand what safety things need to be in place and how we're implementing them relative to our specific situation and our specific business.
Next is Tanya Fletcher, CBC.
Hi there, this is for both of you. Now that Canada and the U.S. have officially extended the non-essential border closure for at least another month, Minister Dix, how long would you like the BC border to stay closed, and under what conditions would have to be met before reopening? And Dr. Henry, you've previously mentioned a possible exception for maybe family reunification. So what could that look like logistically, and what is your message to loved ones worried about having to stay apart indefinitely? And just an answer in French, please, as well. Thank you.
I'll start, and that is something that I do think is important. Now that we know what has happened in many parts of the U.S., we do need to think about ways of allowing families to be together across our border. That doesn't mean, though, it's a free-for-all. What I think my recommendations is that we continue to require isolation plans and that we have a process in place, but that we expand the people who are allowed to come across the border to include people who are who have family or who are residents, and some form of family reunification. But the requirement to self-isolate when you come into BC will still be there, and will be there to ensure that you have those plans and that they're effective.
I think the short answer is not soon. I know that this extension has been negotiated by the federal government. I'm obviously very pleased at that, very pleased at the work that they've done to ensure that we continue not to have non-essential visitors crossing the border at this time. I think the question was asked about Alberta earlier. Well, Alberta is enacting many of the measures we are. They're working with us closely every day to ensure and to fight the spread of COVID-19 in our country and in our provinces. We know exactly what they're doing. I think it's fair to say that that is not the case in the United States, where we are very hopeful, of course, that everyone in the United States, to the maximum degree, stays safe from this and recovers from this as quickly as possible. But the situation is much less clear there. I'm not convinced there's much chance that it will clear sufficiently in the next month to change at least my mind about whether we should open the border. I think it's going to be significantly longer than that for visitors, I should say. Obviously, essential traffic is happening now. So I would say the short answer is that we support the federal action today. We think it's the right thing to do. We think it's going to be almost certainly needed after 1 month from now, and that it's going to be a significant period of time. En français, je dirais que la fermeture de la frontière américaine pour les visiteurs reste essentiel, reste un élément essentiel de notre stratégie. Nous pensons que maintenant, ce n'est pas le moment de mettre au risque tout ce qu'on a fait en Colombie-Britannique en ouvrant cette frontière. Le Dr Henry a fait référence aux familles qui sont aux autres côtés de la frontière, et cela peut être considéré dans les mois à venir, mais je ne vois pas un changement bientôt. Et de toute façon, nous en Colombie-Britannique restons convaincus sur la nécessité de fermer la frontière américaine aux visiteurs pour le moment.
Next question is from Victoria Chang, Ming Pao.
Oh, hi. Mr. Dr. Henry, my question is about we see so many hate crime happening in Greater Vancouver, especially against Chinese. And even before, I think Dr. Henry did mention about a first wave of COVID-19 confirmed cases come from China. But after that, only then we received so many more from Washington State and then also from Iran. But however, our society treat Chinese or Asian face to be linked with virus. So for this, I'm not sure if Mr. or Dr. Henry want to say something about this and try to encourage people not to treat Chinese have something to do with the virus.
Yeah, it continues to make me incredibly sad when I hear these stories, and particularly the underlying racism that it exposes. And there is no place for that in our society here in Canada and in British Columbia. And I know people in BC are better than that. And I will absolutely support you. This has been a virus that does not understand our geopolitical social borders, and it affects all of us. And the only way that we can get through this incredibly challenging and terribly difficult time is by being together and working together and being considerate and kind to each other. And I have said that many, many times, and I will continue to say that. There is no one race that is affected by this. There is no one age group. There's no one sex. It's all of us together who need to work together and support each other and have compassion to get us through this. And there is no place in our society for racism.
I think we have to do what we've been doing. I know the Premier has done it in particular, which is to call out acts of racism for what they are. They are themselves something devastating to civil society, to the way we want to be as a province. And I think that we need to condemn them specifically. We need to condemn them always. And we need to build communities that are more resilient from them. It's one of the things that we're trying to do. And this has been led by my colleague Ann Kang and initiated by my colleague Ravi Kalan in building more communities that are more resilient against racism. I'm going to say, and we just spoke about the United States, and you know, there's lots of criticism in this matter. And we see American television. But I, as someone who's lived near the United States all my life, admire the United States, admire Americans. And the fact that they're struggling is nothing but a sorrow to us. And nobody, I think, would point the fingers at Americans in that circumstance. Americans we know are in our midst for their responsibility. This is true for all peoples of the world. This virus is in well over 100 countries. It's essentially in all of the countries of the world. And this is something as a world we have to come together to deal with. As a province we have to come together to deal with. And it seems to me that racism represents the opposite of what we need to do, something we need to condemn, something that undermines everything we're trying to do together as a society. I'd like to say finally that I think that overall, and you've seen this in the response to COVID-19, that the call for kindness that's come from Dr. Henry today has been overall reciprocated in BC society in remarkable ways. And I am grateful for it. I am grateful to live here. But part of that action we have to take together is to ensure that where we see injustice and racism, that we condemn it, and we condemn it every time. We'll continue to do that. I know that we need to do that in our health system, and I think we need to do that as communities. So if that's a long answer to the question, it's always unacceptable, and we have to condemn it always and build better communities. That's what we're all trying to do together.
Richard Zisman, Global News.
Spoke to a little bit earlier. You mentioned there's different streams for both employees and individuals of the public to bring forward concerns if they feel a business is not following regulations. Can you explain those different streams for me? And also, what penalties will there be for businesses that put the public's health at risk by not following along those regulations?
Yeah, so once again, these are not regulations. What they are is guidance documents and the requirement, with the exception of the requirement to have a COVID-19 plan. So the plan is something that you must have, and it must be available to the public. But then the guidance needs to be adapted to your unique situation of your business, your physical layout, the population you serve, the employees that you have. And you need to make accommodation for the concerns that your employees may have. As we know, this has been something working together between public health and WorkSafe BC, and WorkSafe BC has been taking the lead on the interaction with the different sectors of industry to make sure that the guidance reflects the needs and the concerns in that industry. So if you are an employee and you have concerns about your workplace environment, as in any other environment, WorkSafe BC is the place to go to get the advice or the to have the complaints if you have complaints. You can also, of course, go through your unions if you are unionized. But we always, in public health, play a role in the protection of the health in the public. So it's the environmental health officers on our teams who do things like restaurant inspections, which are things that we do all the time to ensure that food is safe. We do inspections of food processing plants, of all kinds of water systems, etc. So they are the experts on making sure that people have the advice and have the processes in place that can keep the public safe. So if you have concerns about safety in a business, whether it's a nail salon or a restaurant, then you can complain to your local public health, and they will do an inspections depending on what the risks are, and there's various different levels of inspection. But again, our approach on regular times is that we take an educational approach. Our first line of action is not to find people or shut them down, it's to ensure that they are taking the necessary actions that we need to keep people safe. Having said that, there are abilities for environmental health officers to shut down a business if they feel that there are health hazards that put the public at risk, and there's protocols that WorkSafe BC can as well, and they have provision to fine people if needed. But our first approach is to help people through this. It's, like I've said, it's not something we've done before, so we need to make sure that everybody is being thoughtful about it and that they're enacting the plans that they've made and that they're working. So that's the approach we'll be taking.
Next question is from Binder Sujjan, CTV.
Hi there. I'm just wondering if you might be able to provide a bit more detail about the 2 deaths in Fraser Health. Wondering if they're connected to the Langley Lodge, and if you might have an update on sort of the total number of cases and deaths at that facility. There are families who are saying that they are receiving a lack of communication, and just wondering if you might be able to shed some light on that.
Sure. Unfortunately, there has been, as we know, an ongoing outbreak at the Langley Lodge, and it's been a very challenging one for a variety of reasons. And my understanding is that at least one of the deaths was indeed from that place. Let me just find it here. So the number of cases that we have from Langley Lodge as of today were 43 residents who have been affected and 7 staff members, including 8 deaths at that facility. So yes, that reflects transmission within the facility, and I know that Fraser Health has been working very hard with the facility to try and make sure that all of the provisions that they need are put in place, but it has been proven to be a very challenging one. And sadly, that's reflected in the number of the seniors and elders in that facility who have died.
Jane Side, North Shore News.
Dr. Henry, I have another outbreak that I wanted to ask you about, which is the Lionsgate Hospital outbreak. I've had people ask how the outbreak at the hospital actually started in terms of how it got in there, whether it was brought in by staff or whether people were brought in from long-term care homes or just people who may have had it in the community and developed it while in hospital. People are a bit confused about how the latest outbreak in the hospital started, and they're also wanting to know how it then gets spread in the hospital among the staff and patients that it did spread to, given the kind of infection control measures that would be in place there.
Yeah, it would be nice if we had every detailed answer to these, but this is the work that the investigative teams from public health have been doing. My understanding, the latest outbreak at Lionsgate was related to, again, an unrecognized case, and by the time the case was recognized, it was not a transfer from a long-term care facility, but by the time the case was recognized, a number of others had been exposed already. And as we know, once you've been exposed, there's nothing we can do to prevent you from becoming ill. So it meant that people had to be isolated through the period of time of the incubation period. And there was cases of people who had been exposed, close contacts who were in staff, as well as other patients in that ward, and some of them had gone home already. So there was a complicated investigation. And you know, this is again, speaks to how challenging it is with this virus, because people can be ill with it without recognizing it, particularly early on, and that can lead to people being exposed before we recognize that this is what is causing the illness in the person. And the challenging thing is that people can have other illnesses that take them into hospital, and it's not recognized that they also have COVID-19. So the best of my understanding, and since it was recognized as being that a number of people had been exposed, the infection control precautions have been changed and modified, and a number of people who are ill have been isolated within the facility. So I'm hopeful that that will control it.
Next question is from Lisa Cordasco, CHLY.
Thank you. Good afternoon. A theme in many of these questions, especially ones about guidance, seems to be that finding that balance between, you know, personal or business autonomy and guidance from professionals in the health and work sectors. And, you know, in that, I guess, philosophy, I'd like to ask this question about the wearing a mask. I mean, a lot of people are expressing concern, especially seniors and even other retailers, you know, calling for a mandatory mask order of some type. And I know you've already spoken about these masks and how it helps to protect others from you if you're carrying the virus. And you probably don't want to add to a false sense of security around that. But I'm wondering, to what degree is your position in not ordering mandatory masks have to do with, you know, acceptability and tolerance by members of the public who would have to wear them? And you know, philosophically, that balance between personal autonomy and being informed.
Yeah, it's a little bit of all of that, but mostly it's based on the fact that there's not any scientific evidence that it actually, in and of itself, protects people. So it's not that you can wear a mask and not do the other things that need to be in place. And very much like we've been saying all along, there are important measures that we know work. An addition can be for those short periods of time where you must be in somebody's safe circle, then you can wear a non-medical mask to protect, to keep your droplets in and protect others. So I do see a role for them now, and as I've talked about, you know, our understanding of this virus has evolved, and so the role of non-medical masks has also evolved, where we know that people can have milder illness or may not recognize it early on, and that keeps your droplets in and protects others in that way. So it's not something you do instead of, but we should be, I believe, at this point, prepared to wear a non-medical mask in certain situations where we cannot maintain our physical distance. And for those situations that I can think about now that are ones that are plausible are things like using transit, where we might not always be able to keep that physical distance, where we're in a small store where it's difficult to keep that distance from people for the short period of time that we're there, and for places like hair salons where you're going to have be closer to somebody. But it doesn't take away from the fact that you still need to minimize that time. So when we're talking about risk of transmission, there's a couple of things. We know it's when people are coughing or talking or singing and the droplets are in the air and I'm in their close space. Those droplets don't last long and they don't travel far. So we need to be within that circle. And we also know that it is a time thing too. That's why, you know, I say being outside is safer than being inside. And walking by somebody is not a situation that puts you at risk of breathing in their droplets. So if somebody's running by you, that the few seconds that they go by you, it's spending time in that circle. So that's where a mask can be helpful. So if I'm sitting on a bus and there's somebody that is 3 feet away from me instead of 6 feet away from me, if we both have masks on, that's a good thing. If I'm getting my hair done, which I expect to do hopefully soon, I will wear a mask, and so will the person who's doing my hair, so that we can protect each other for that period of time where we need to be in that short period of time. But we're also going to minimize the time that we're in that close space with each other, and we're going to not have our conversation face to face, because that's when we can transfer droplets more effectively. And we're going to put in those measures where we mostly try and keep our distance. So those are the types of situations that we're looking at right now where I do feel a mask is in order. Having said that, for some people, particularly young children, people with lung disease, it can be very challenging to wear a mask, and so they may need to forego some types of activities right now. It may not be appropriate for an elderly person with lung disease who can't wear a mask to take public transit for the next while. I may need to forego having my hair done if I am not able to wear a mask. So those are the considerations that we need to think about, both our own personal circumstances and how we're going to interact with others in the coming days and weeks. It has changed, and we've evolved as we've learned more.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Craig McCulloch, KNKX Radio.
Thank you for taking my question. Following up on other questions about the border, what type of conversations have you, Dr. Henry, and you, Mr. Dix, if you've had any, what type of contact have you had with your counterparts in Washington State in particular, as well as Alaska and Oregon, but in particular with your colleagues in Washington State?
So I have a weekly meeting with my counterparts, so the state health officers in what they call Region 10, so Alaska, Washington, Idaho, and Oregon, and we exchange information on a regular basis. We've talked about borders. They are very much like us in the same situation of having concerns about international travel. We've talked about our aligned approaches to things like cruise ships, for example. Alaska has had far fewer cases than many of the more southern states, so they have different measures in place that are aligned. So we do talk about these things on a regular basis, and I have a much better idea of how things are going in those states, and have been in contact over the last number of months.
Well, as you know, Mr. McCullough, the Premier has been in regular contact, in particular with Governor Inslee, and that's with Washington State, that's the principal contact. There have been others, but that's the principal contact. I must say, and I think it's important to recognize this, that in spite of the challenges they've had in Washington State, their public health officials have, under the circumstances, done a very, very good job, an excellent job, in fact, in dealing with the situation. I think their vision of what needs to be done is very aligned to ours. And so we're very appreciative of the work they've done, and we're very hopeful for their success, because as we've seen, the success of all jurisdictions rests in part on the suggests in the success of all the others. So there's a very, very good relationship, in particular between the Premier and Governor Inslee, and those discussions happen on a regular basis. Equally with respect to Alaska, certainly on issues such as cruise ships, they're very aligned with our concerns, as are the people in Washington State about any resumption of the cruise ship industry. Thanks very much. Merci beaucoup. We'll see you Thursday.
Thank you.